Hi, I'm Kelli Allen. I am co-editor-in-chief of Arthritis Care and Research. I'm an exercise scientist and a health services researcher, and my work focuses on clinical trials of behavioral and health services interventions for individuals with rheumatic and musculoskeletal disease. I focus largely on osteoarthritis, but also collaborate with colleagues on research in other areas.
Hi, I'm Dan White. I'm a physical therapist, and I am a scientist who studies primarily physical activity and physical function in people with arthritis. My research really investigates both clinical trials and trying to understand, what are methods we can best use to help people become more active. Arthritis Care and Research is interested in publishing a broad clinical focus on all rheumatic conditions. So given the chronic nature of many conditions, there's a major need for long-term management. And we are interested in research from all aspects of clinical care. So this includes mechanistic studies to large cohort studies of populations. And a key need is that there needs to be research that moves the needle for our understanding with how we can better care for our patients with rheumatic conditions.
So we are always interested in improving operations within the journal in terms of just the back-end functionality of the mechanics of our review platform, but also how things are going operationally within our process for identifying reviewers, making sure we are doing as best we can to provide timely reviews. We're also really hoping to engage our editorial board over the next 5 years. We have done that historically, but we've been thinking about maybe some new ways. We have wonderful editorial board members who are very engaged with reviewing papers, but we think there's some other ways that they will really be able to contribute to the bigger picture operations and health and growth of the journal. So we're thinking through how do we engage those individuals best to hear their ideas, gain from their skills and their communities and their perspectives to grow this journal in some strategic ways.
As a journal, we want to increase our partnerships or strengthen our partnerships with 3 select groups. First is authors and reviewers. This is the bedrock of our journal. And specifically with authors, we want to better acknowledge their role as a peer reviewer for our journal. We want to provide authors with the ability to showcase their work within the journal and throughout things like journal clubs and interviews with associate editors and us as editors-in-chief. We want to also provide sort of perks for disseminating their important work. This can include graphical abstracts and writing up their article in other AC&R publications such as The Rheumatologist. And then specifically with our reviewers, we want to enhance our connection with them. They do a volunteer job that's central to our journal, and we want to better recognize that valuable work. We really acknowledge that work that they do and want to better find ways that they can show that important work to their various different shareholders. The next group is readers and clinicians. This is an important shareholders in our journal, and we want to explore ways we can enhance the readers' access and experience. And this includes things like updating the journal website and enhancing our communication to readers and finding novel ways to get the word out to them. Finally, to the public, we want to enhance our activities to share the important content Arthritis Care and Research has more broadly with the public and to clinicians and to patients. The public and specifically patients and our clinicians are just really important shareholders in our process, and we want to continue to strengthen our bonds with them.